So we started to adjust him, and I suggested he gets one of those machines that he hangs upside down. And I told him to eat more protein. We gave him a product called Ligaplex 2. Because if he doesn't correct that, if he doesn't follow through, and I showed him how to do some butt blasters to get his butt strong and some abdominal exercises. If he doesn't do that, what's going to happen, he's going to end up putting 3 screws in his back with rods. You can just put down on the ground, thanks. Okay, so what I'm going to share with you now is very significant. We're going to talk about what is referred pain. And this was a blessing for me to learn this. You know that for me, Marie? Just right there, thanks. About 20 years ago, when I really started to understand, is when I started to really get a grasp of what you eat can cause pain. So I was having all these patients come into the office that their left neck was bothering them. And for the life of me, I couldn't figure out what was going on. So I said, Lord, I just need to know what's going on. So I was driving along, all of a sudden, it was like a bolt of lightning. And here's what happened. I went back to my embryology class. Now, you may or may not know, but my youngest son is going to chiropractic college right now, and the first semester they always make you take embryology. And most students always whine and complain. I'm not saying he did. I said, Anthony, whatever you do, you learn as much as you can about embryology, because what I learned in embryology has changed and affected my career. Because what I learned was this. There's an organ in your body called the pancreas that embryologically starts right up here in your upper back on the left side. Embryologically means while you're inside of your mother's uterus. But then it moves over to here. It moves right over to here where it's at right now. It moves. But it gets its electric innervation from up here on your left neck and upper back. Now you're going to be fascinated by what I'm going to share with you right now. Your pancreas, let's say, is like a motor. Now, gentlemen, if you've ever overheated a motor, what does the motor do to the circuit breaker? It causes it to trip. The pancreas is like a motor. And if you give a motor too much heat and work to do, it's going to trip the breaker. So let's just say your upper back is like a set of breakers. So when you eat too much sugar, what does that mean, Dr. Bob? I had people eat 2 Hershey Kisses. It can cause their left neck and shoulder blade to hurt. So let's just say instead of this being the heart, it was the pancreas. When you eat too many sweets or ice cream or yogurt or candy bars, you'll notice your left neck hurts and your left upper back. That's because you've been stressing your pancreas out, and it's referring pain to your left neck and shoulder blade area. This is really important because I'm going to share something with you right now that's going to be so significant. So when I can even demonstrate on an x-ray. When somebody comes in my office and I'm looking at their x-rays, and this is the part of the spine that I'm talking about, this is a thoracic vertebra right in here. Well, normally, if somebody worked at a factory and all day long they did a drill press like this, all the vertebrae will shift to the right. But when you have a subluxation caused by diet, this vertebra, let's say for example, will go right, the first thoracic, this one will go left, the other one will go right, and the other one will go left. Are you ready for a $1,000 term? It's called a pathobiomechanical subluxation. What does that mean, Dr. Bob? That means what you're eating is causing the subluxation. Now, want me to give you some death-defying news? That's the area that goes to the heart. So what did I just tell you? What you eat can affect the nerves that go to the heart. So you could have heart challenges because of eating the wrong food. Now, will medicine ever figure that out? Long after I'm gone. So what's happening is that the nervous system controls everything. Now, I'm going to share something else with you that I've learned. You see, it's really great because when people come in, God gives you 2 ears and 1 mouth so you can listen twice as much as you speak. Well, what I've learned is this part of the spine here is the lumbar part of the spine. Are you ready for this? Because I've never read this in the book. I have to write my own book and put it in it. The vertebra in the spine always shift to the left in somebody that has had gallbladder surgery. When somebody comes in my office and they had gallbladder surgery, 90% of the time, these 2 vertebrae up here on the left are always twisting, or these 2 vertebrae up here in the upper part of the spine are always twisting left. Isn't that fascinating? So if somebody comes in my office and they have the symptoms of pre-gallbladder, which is fat, fair female in 40, and don't take that personal. Fat, fair female in 40 are common ones to get their gallbladder up. So I have a woman that comes in like that, and the vertebrae are going left. What do you think I'm going to tell them? You better change, or you're going to end up getting your gallbladder up. You want to know why? People get their gallbladder out have a greater chance to get cancer and a greater chance to get heart attacks. Do you see how this is all tied together? So when you come into the office and I start adjusting your spine, it's like insurance. I don't know how many of you have ever gone to Las Vegas. Back in the 80s, when my wife and I went to a lot of seminars, they used to have seminars in Las Vegas. So I used to play blackjack. Now listen, I'm not a blackjack expert, but I know when you go to the blackjack table and you put a face card down, or face cards up and whatever, the dealer always says, insurance, he does a little crescendo there, so that means you better put some money down, because if not, if he gets it, he's taking everything. Every time you come into the office and we give you an adjustment to your upper back on the left side, guess what we're giving you? Insurance. Heart insurance. You might not realize it, but when we're adjusting your spine, so in my 30 plus years of practicing, guess how many patients of ours died of a heart attack? Less than 5. And those 5 smoked, drank, and ate prime rib. So generally, our patients don't die of heart attacks because of what I just told you. Isn't that awesome physiology? So how important do you think posture is then? Posture is everything. Why is posture everything? Because your posture is off, your spine is off. If your spine's off, your nervous system is off. And we've had enough patients, and some of you sitting in this room, you can breathe better, your sinuses clear up. I think one of the most fascinating testimonies is when somebody gets off the table and they have this big old grin on their face, and they look me right in the face and they say, that was faster than Benadryl. Oh, that's huge. And I know that some of you, when I've adjusted your upper neck and your nose clears up, it's awesome. So the power in your body, I just love this visual, is in the circuit panel. Our spines are like circuit breakers. That's important. So the secret weapon that you have for your health is that when you get an adjustment, we're turning your switches on. I don't heal anybody. All I do is turn the switch on. And then I motivate you enough to make dietary changes, and we show you the exact exercises that you need to keep your spine in alignment. Now here's another nugget I'm going to tell you. It's awesome. A normal neck looks like a banana. A normal neck curve is C-shaped. That's really important. When somebody comes in our office, we measure the degree, and we also tell you the degree of decay. I can tell you that I rarely see anybody that comes into our office over 70 years old that's phase 3. And you want to know why? It's not that they don't like us. They're dead! Nobody lives that long. If you're a phase 3 of spinal decay, guess what? You're going to die. I didn't write the rules. Because your spinal cord is being compressed. That means your brain cannot send messages down. And I'll guarantee you, I never see anybody over 80 years old that's a phase 3. Now, I can prove this to you because I have a medical doctor that's a radiologist. And that person actually happened to be here today. And I was talking about this to that particular individual and explained to them what I was finding. And I looked at them and I said, well, what do you think? Scratched your head, and guess what they said to me? I don't ever see anybody that old that has decay either. And I never thought about it. They're dead. I'm serious. They're dead. So the reason you want to come into the office, now watch me, this maneuver we give to all of you. We're going to give you this head slide. Now, Eddie and Mary, you haven't got this yet. But we're going to give you, and not you, Ed, but I have another Eddie here. We're going to give you that maneuver, and that maneuver is to bring your neck back into the C position. You need to do that every day. Because happy, healthy people that live a long time have C curves in their spine. It's really, really important. You don't want decay. I should have shared something with you about decay earlier, and I failed to do this. People who smoke cigarettes always have more spinal decay than people who don't smoke cigarettes. People who eat sugar always have more decay than people who don't eat sugar. And I can show you that on an MRI. When I do an MRI with somebody, a decayed disc, you see people that have a decayed tooth and it's dead and it looks brown? When we look at an MRI, it has a different pattern about it, that it looks like it's dead. So people who smoke cigarettes have more decay. So the huge difference now is, what's the difference between what medicine does and what subluxation does? And I think that's really significant, is the fact when you go to see your medical doctor, and all due respect to medical doctors, I think that they each have their place, and I'm not trying to say this to be unkind, but MD really means more drugs. Because you go to see a medical doctor, they're going to usually give you more drugs.